everybody to the Senate Health and Human Services Committee. We're in the Senate Lounge, and there's 4 of us in the lounge, and I'm about 15 feet away from everybody. And with Dr. Chan and others from the health department on there, I want to we have the window open about a foot, so it's about 50 degrees in here. So I'm going to, and everybody's about 15 feet away from me, so I'm going to take my mask off. So I would like to start by having the clerk take a roll of the members.
Senator Bell.
I'm here.
Senator Calkin.
Here.
Senator DeMario.
Here.
Senator Golden.
I'm here.
Senator Lawson.
Here.
Senator Palino. Senator Seveny. And Senator Miller.
Here. So especially in the last couple of weeks, Senator Valverde is also here. So we have a quorum. We're going to get underway. So I would like to start by saying, in addition to our regular agenda, I've invited the Department of Health to present to us on a vaccine update. As senators, we all get a lot of constituent and advocate and a lot of feedback from the community, and it would be remiss for me to, based on what they're mostly calling us about, which is about vaccine and not necessarily about the legislation that we're going to have hearings on today, for me not to take advantage of the opportunity, even though we did have myself and probably many of the committee members also went on the call at 1 o'clock. I think having this forum that is also available to the public and the people who are involved in this legislation to hear directly from the Department of Health, and they graciously, even though, like I said, they are probably some of the busiest people in the state, agreed to give us an update for about 20 minutes before we go on to our regular agenda. So I would like to thank Neil Hauton, who throughout the pandemic has been my main contact on an incredibly varied amount of issues on almost a daily basis, it seems like, on behalf of constituents in developing legislation. And we also are joined with Dr. Chan, who does most of the hard work around this issue for the Department of Health, and Alicia Maholicos, who is Emergent Preparedness and Response for the Department of Health. So whoever wants to start can go right ahead and give us any update you think would be important, and then we might have a question or two after that. So.
Sure. Thank you so much for having us, Chairman.
Thank you for agreeing to be part of this.
Absolutely, and thank you all for continuing to help get the message out to your constituents. There's daily updates, weekly updates, and we're really building the plane, flying the plane as we're building it, and day to day, daily updates, a lot to keep your constituents apprised of throughout this pandemic. So just really want to thank all of you for doing that. As you mentioned, I'm joined by Dr. Phil Chan, one of our consultant medical directors here at the Rhode Island Department of Health, who's going to walk through a brief slide deck and bring folks up to speed and kind of project out where we're going in our vaccination program, as well as Alicia Maholicos, who's done a tremendous amount of work throughout this pandemic on behalf of our Center for Emergency Preparedness and Response. So just want to say thank you, and Dr. Chan, whenever you're ready, you can take it away.
Great, thank you. Thank you, Chairman. Thank you, Senators. It's a pleasure to be here. I will offer one small correction, and that's that Alicia Maholicos has really led this vaccine effort. So I want to acknowledge her effort and Tricia Washburn and the rest of the team. You know, this whole vaccination rollout is really a combined effort of hundreds of people across the state. So it really has been a team effort. and led mainly by Alicia and Tricia. So I just want to acknowledge them. I'm going to share my screen here. Hopefully, folks will be able to see. Can people see the PowerPoint presentation? Thumbs up.
Yes,
Perfect.
we can.
Okay, I'm going to fly through this. There's a couple points that were iterated today on the governor's press conference, and we'll go over a couple new things. But feel free to interrupt at any time. Alicia as well, feel free to chime in if you want to expand on anything. Just want to briefly review phase 1 progress, the phase 2 timeline, talk about some of the recent vaccination channel updates and next steps. I do want to thank the senators here. I know there's been a lot of questions coming in from the community. We're here to help. We're here to help answer questions. And thank you for your work getting the information out. We know that you all have been getting a lot of questions. And we're still in the rapidly evolving implementation phases of vaccines. Hopefully this will smooth out, if you will, in the next few weeks, where I know that the team here at the Department of Health, again, led by Alicia and Tricia, have really been working hard to get some of these processes implemented. And we are optimistic in the next couple of weeks, if you will, that things will kind of come into place and the process will be much smoother going forward. I want to remind people that we've been guided by a number of guiding principles in terms of vaccine implementation. Obviously, safety. We have a vaccine subcommittee again that reviews all the data, all the FDA, CDC guidance that's been released. Talk a little bit more about this. I want to again mention that really one of our goals as we think about vaccine implementation has been to minimize morbidity and mortality. And that's one of the reasons that we'll talk about is why we're really prioritizing people who are a little bit older, as well as people with certain health conditions. We also want efficient distribution. I think a key, certainly of the vaccine rollout, is that we really don't want any unused doses at all. And we want to make sure the vaccine gets to the right people and the right groups. And so it takes a little bit of logistical planning to make that happen. And finally, we want to ensure access to the vaccine for all Rhode Islanders. And I think many of you are aware that we have prioritized certain geographic hotspots, and thinking mainly of Central Falls at the moment, but really communities that are affected most. And we want to make sure that the vaccine is accessible to all Rhode Islanders, people that may not have access to the internet, people that may not have access to transportation, etc. So all that is on our minds, and our goal is really to get it to everyone. I think one of the key points is that vaccine supply continues to be limited, and this is really a critical point. Obviously, our goal here in Rhode Island is to vaccinate everyone. We'd love to give everyone a vaccine tomorrow. I think we've been thrilled at the demand. I mean, that's really one of our public health goals as well, is for people is to have a campaign to do messaging and education. And we're really thrilled that the demand for this vaccine has been so high. But again, the fact is that the supply has been so limited. We're only receiving about 16,000 doses each week. However, I want to preference that and say that we are incredibly optimistic. There's been a lot in the national media about improvements in manufacturing processes by Pfizer, by others. And I think the last point, too, the third point here, is that some of you may know, but there's a third vaccine that's on the horizon of being authorized by the FDA. In fact, it was submitted within the last week. The FDA will be meeting during the last week of this month. And hopefully we anticipate by the end of this month, if not the first week of next month, is that we will have a third vaccine here, which will obviously speed everything up. And there's a fourth vaccine on the horizon as well that will be coming in the following months. So in general, I think all good news. We, the state Department of Health, the state in general, is taking every measure to make sure that the vaccine is being administered safely, equitably, and as quickly as possible to get it out to all Rhode Islanders. I think many of you have seen the slide before, but just to reiterate that we are working through and have been working through phase 1 populations. I'm not going to go through each one of these populations in detail, but we really have focused on folks in the healthcare setting in general, as well as first responders, primary care providers, etc. We're currently now really working through the last component of phase 1, which is phase 1.5, and that's adults age 75 years of age and older. And some of you may have seen the slide today, which was presented at the governor's press conference, but I think this is really remarkable. And this speaks to the fact the vaccine is getting to the groups that really need it most. And in terms of our healthcare setting, right, the healthcare workers are being exposed continuously to COVID. And people, the other important thing to keep in mind is that people are also start to die more if our healthcare system becomes overwhelmed. And I think as many people are aware, we were actually at the point where we had to open up field hospitals in the last couple months because our main healthcare systems were so overwhelmed. And we know that when that has happened in other places, other countries, other cities, is that people start to die more often because they don't receive the healthcare that they need in order to survive. And so for many reasons, the CDC and others have recommended healthcare workers to be vaccinated first. And you can see here the success that that's had. You can see over the past couple months, of course, we've been in our terrible second wave and healthcare workers have been affected. But over the last few weeks, as healthcare workers have started getting those second doses of those vaccines, we've seen a precipitous and a tremendous drop in COVID cases among healthcare workers, more so than other sectors. And this is also reflected in the long-term care community, nursing homes where we've vaccinated there. So we are getting vaccines out to the populations that need it most. I think this is very reassuring for sure, and hopefully a sign of more to come, especially as we open it up to the general population. I wanted to quickly go over as well the percentage of, talking about the number of doses administered here in the state of Rhode Island to date. So we've administered over 120,000 vaccines, and that's 78% of the total vaccines received in the state as of February 8th. And I think one thing, one question I think that many of you may have received, and one that we receive is, well, why aren't we administering 100% of doses? A lot of people, the CDC website has a total number of doses that they distribute to each state, and I think there's an expectation by people that should be close to like 90% or 95% or 99%, if not 100%. And the fact of the matter is, I like to highlight three reasons why there's a discrepancy between the number of doses allocated and the number of doses that we actually administer. The first reason is that there's a time to transit, right? So when the CDC allocates us doses, they have to be shipped from across the country. We then get it. We have to allocate it. They come in bulk shipments, packages of 100 plus. So we have to allocate them and then distribute them to different sites. And that goes to the fact that we don't want to waste any doses, and also to the fact that there's cold chain requirements that have to be met. So it does take a little bit of time to get those doses, to receive those doses, and then get them out. The second reason is that you can see here is that one of the holdups has been through our pharmacy partnership. So this is Walgreens and CVS. This is a partnership that most states in the country signed on to. It means that the CVS and Walgreens pharmacies are getting allocations directly from the federal government. And they've been a little bit slower than I think we'd like and many others have liked. And you can see here that they've distributed about 56%, administered about 56% of their doses, which is pretty low, lower certainly than our average, and through other vaccine channels as well.
Excuse me, Dr. Chan.
Please,
Can
please.
I ask, when you mentioned the 16,000 doses each week, that number doesn't include the pharmacy partnership, right? That's an additional number?
It does include the pharmacy
Does?
partnership. It does not include second doses. So when you hear that 16,000, at whatever number we receive that week, 3 weeks later or 4 weeks later, we receive the appropriate matched amount of second doses. So sometimes that's a little bit confusing when you're looking at these numbers and you see the week of January 31st, we gave 13,305 first doses. That's because that's 13,305 out of 16,000.
Thank you.
Great, and that's the third reason why we're not at 100% of vaccines administered, is because we do hold back for a short period second doses, right? So the Pfizer vaccine has to be administered, should be administered, it's recommended at 21 days after the first dose, the Moderna 28 days after the first dose. And so if we get those second dose shipments a week early, we don't just push them right out, we make sure that the vaccine is administered within the appropriate time frame. So those are some of the reasons why this number isn't 100% per se. 78% is pretty good, we're getting there. I think you saw the healthcare data. It shows that we are focusing on the correct population, and we are seeing an impact, certainly in the sectors that we've started. And obviously now we're moving into the general population, which is exciting, and will hopefully lead to the same declines that we're seeing. As we move into phase 2 here, the guiding principles, and again, I want to emphasize this was on the first slide there, but it's really to minimize morbidity and hospitalizations. So we are taking a data-driven, evidence-based approach. And really, when you look at the evidence, I think one of the things that's been most striking about the pandemic is it really affects older adults the most. And in fact, adults that are over 75, over the age of 80, they have a 15, 20+% chance of dying. And I think as we've seen in our state, unfortunately, the vast majority of deaths in our state have been among the older populations, and especially those in nursing homes. So one of the silver linings is that children and kids aren't affected very much, which is fantastic. But the age, out of everything, it's really the age that is the number one risk factor, as well as other health conditions. And we'll talk about that in a second. The other two guiding principles in terms of phase 2 has been the focus on equity, on populations that are affected most. We want to make sure that regardless of race, ethnicity, socioeconomic status, that the communities and the hotspots in our state are affected most. And one thing I'd like to remind people, right, is that every single dose of vaccine administered in this state is a one small step forward in protecting all of us. And so it makes sense to prioritize those people that are most at risk, even if it's not you or your immediate family member, just reminding everyone that really every single dose we give is a step in the right direction. And of course, on all of our minds is the fact that we want to reopen the economy. Obviously, people's livelihoods are at stake, et cetera. So we want this to work. We are working to get vaccine out as fast as possible, and we want things to stay open in general. Here's and I want to emphasize a preliminary timeline of where we are. This does not take into account, for example, that the Johnson & Johnson vaccine may be authorized for use later this month. So this is where we stand at the moment, but as we all know, things rapidly evolve during this pandemic, and certainly things change from day to day, week to week, et cetera. But you can see here, we're now, early February, we have begun to vaccinate people age 75 plus years of age. We anticipate in the next couple of weeks that we'll open that up to 65 to 74. And then we're going to start with people with other underlying health conditions of all ages. And then as we move through other age groups in 4 to 10-year intervals. Again, this is a preliminary timeline, and I am optimistic that it will be much quicker than this with the improvements in manufacturing, both from the current vaccines, Pfizer and Moderna, as well as other vaccines coming on. In terms of what types of underlying medical conditions we are prioritizing, these are here. I want to, again, emphasize that this is based on data that we have here in Rhode Island, data from across the U.S. that shows that people that have these medical conditions are at much higher risk of developing severe COVID and dying. And so I'm not going to go through all these. Most of these should make sense. At the end of the day, what we're going to do is to defer to the clinical community, to defer to people's doctors and other healthcare professionals in terms of identifying people that are going to be at higher risk. People with diabetes, people with lung disease, obviously, heart disease, kidney, renal disease, and weakened immune systems, which includes people with cancer, people who are on chemotherapy, who have had or are waiting for a transplant, HIV, AIDS, sickle cell disease, pregnancy, and other people that may be taking a medication that will weaken their immune system. In terms of how we're getting vaccine out, there's basically 3 ways that we're going to be getting vaccine out to people. And the director went over this today, but just to briefly reiterate, number 1, we're going to have state-run vaccination sites. So think about portal.ri.gov, right? This has been a successful model that we've used for testing. We're going to have a similar online portal that people can register. We're going to have a couple of mass vaccination sites. Sakanasset is already open, that we've been focusing on using that for the healthcare providers. The Dunkin' Donuts Center is going to be open to the general public in mid-February. And we're exploring additional sites. So it's going to be similar to our testing network, if you will, the portal. I want to emphasize that besides just an online portal, we're also going to have a phone number for people to call. So for people without access to the internet, people without access to technology, there will be a phone number with a real person that they can call and register. We're also making allowances I briefly touched on, but for people that may be homebound, We are working on partnering with some agencies to get vaccine out to people that may not be able to come. I think one thing of important that's going to come up that everyone, all of us is going to have to deal with is that it is going to be first come, first serve. And so what that means, of course, is that with limited supply, people are going to have a tough time getting through. There's going to be some frustration. We apologize for that. We are frustrated too. Again, we would give vaccine to everyone tomorrow if we could, and that's our goal eventually. But there's going to be, just by the nature of the limited supply and the way that this is going, is that there will be frustration. There's going to be people who can't get through, et cetera, et cetera. So we're going to do our best to make this as smooth as possible. But I just want to again, meet expectations that we're not going to be able to vaccinate everyone when this is first opening up. Secondly, I think a lot of people are aware as well, CVS and Walgreens in their community pharmacies are getting a supply of vaccines, which is exciting and fantastic. So CVS and Walgreens, through their websites, people will be able to register to get vaccine at numerous locations throughout the state. Some of them are listed here. It's listed on their websites as well. Again, the pharmacies will also be getting a limited dose. So people have already reported some problems getting through to the pharmacy websites as well. So that's something, again, just to let people know is that there's still going to be a backlog on some of these sites in terms of getting vaccines. And finally, and I think pertinent to some of you, is that cities and towns themselves will be getting a supply of vaccine as well. And so we're delegating to the cities and towns in terms of what they want to do. This has already started, but we're leaving it to the cities and towns to determine how best to allocate their supply as well. This is, I think, the last slide here, but in terms of the state-run vaccination sites, just to emphasize, starting next week, so Thursday, February 18th, the first state-run vaccination sites will open to the public, the Dunkin' Donuts Center and the Saconaset site in Cranston, for people who are aged 75 years of age and older. So roughly 500 doses will be administered to start at the Dunk. Roughly 900 doses will be administered to start at the Saconaset site. And obviously, as more vaccine becomes available, we will expand capacity. And obviously, we'll open it up to additional groups as we move. I think importantly, registration will be required. You cannot just walk in. It's not walk-in vaccination. I think importantly, we don't want crowds, right? One thing that we don't want during this pandemic are groups and crowds of people to show up. It needs to be one at a time, obviously, to minimize risk. And people will be able to register starting on Wednesday, February 17th. So 6 days from now, less than a week, people will be able to register, and it will be starting on Thursday. So we apologize for the delay in getting the system up. Obviously, we're building out a new system, a website for this. It's taken some time. But once it's up, we anticipate that people will be able to register right away. And we'll also have a phone number to call for that. So again, just reminding everyone to be a little bit patient and as demand still outweighs supply, but we're getting there, and it's exciting that we're moving in this direction. Alicia, what did I miss, or what else would you like to add to this?
I think you covered it very well, Dr. Chan. I think you emphasized the right point, which is that you may be getting a lot of questions from your constituents, especially about the opportunities that exist at the municipal level. We know that the municipalities have carried a heavy burden in terms of answering questions of their constituents, in terms of developing lists of their own so that they can help prioritize individuals who are going to get vaccinated by age or other priorities. But we are excited about the opportunity that they will begin early next week. We did a pilot in the last 2 weeks to start getting folks who are 75 and older vaccinated, but their planned allocations will occur over the course of the next 4 weeks. And we are excited to, after looking at the data and examining what the impacts are for folks with each additional decade of age, to be able to have all of these channels available to folks who are 75 and older so that we can ensure comprehensive coverage and we can get them through their first doses, quickly followed by their second doses while we open to the next age band so that we can, again, try to push through as much vaccine as possible. As Dr. Chan mentioned, the other thing I'd really like to emphasize is that we've been building capacity all around. We are not utilizing our full capacity for any of the channels that we currently have. So it's been an opportunity for us to pressure test some of the systems to see what works well and where we can put additional vaccine when it becomes available and where we may need to shift our plan. So we've been really focused on ensuring that when more vaccine becomes available, there will not be a pause in our ability to push it out and to get people vaccinated as rapidly as possible. And so we're hopeful for the Johnson & Johnson vaccine, and that when it becomes available and we know to whom it should be administered, we'll have the opportunity to push that out the door as quickly as possible as well. Dr. Chan did not talk about, I'm surprised, some of the concerns that we have about variants. And again, the additional emphasis that we have on getting folks vaccinated and as quickly as we can before the variants arrive and take hold. And so we've been doing a lot of work on that front as well. We believe that our strategy has worked well in terms of, as you've seen, our morbidity and mortality data in terms of older adults, especially those who live in congregate settings. So we've had a lot of success in terms of nursing home residents, assisted living residents, folks who live in behavioral health group homes or developmental disability group homes, as well as many of our HUD 202 sites for older adults. So we are hoping that the vaccine, having pushed the vaccine in those directions and having good uptake by the residents in those facilities will help us drive down any of the additional activity in the way that we saw it drive down activity for healthcare workers, so that we can protect those who are the most vulnerable to bad outcomes related to COVID.
So I will start it off with a couple of questions that I've been asked that may help in others. I myself don't look at it as a national competition and how's Rhode Island doing versus other states, but other people use that as a barometer. And can you identify some of the hurdles, and that are you over those hurdles to get Rhode Island quote caught up versus other states? Is it getting the state-run sites up and running? It's getting through healthcare workers, which is another question of mine. How soon do you feel you'll be through the healthcare workers and the congregate setting population and towards just population based on age or other criteria?
Sure, Chairman. Thank you for the question. I think that we are very forward-leaning in terms of being able to address the general population through all of the channels. Starting next week, again, we've begun the process of individuals who are 75 and older, and we will push as hard and fast as we can with the vaccine we have available. If you saw the slide that Dr. Chan presented, over the past few weeks, we've been around the 90% mark of vaccine that's in our direct control being administered, which we think is a phenomenal opportunity. We have more nursing homes in Rhode Island than most other states, and because we engaged in the federal partnership with CVS and Walgreens, and because there were rules that surrounded how we allocated vaccine as part of that contract, we have been just recently able to take vaccine out of that program if it's not immediately being utilized and redistribute it. So we do not want to shortchange that program. We feel very firmly that the partnership has some of the best intent in terms of the target audience for those who should be vaccinated, and we want those people to continue to be vaccinated. We know there was some healthcare worker hesitancy, especially in the long-term care community, because they were first and they were getting vaccine first and were a little bit uncertain about whether or not that was an avenue they wanted to pursue. But we have seen, thanks to Dr. Chan and his educational processes, we've seen a shift in that. We've seen more healthcare workers who are interested in getting vaccinated, and we want to ensure that they are, so that we can protect those people. But as the partnership comes to a close, we are entering the third set of visits in nursing homes and the second set of visits for assisted livings, adult behavioral health group homes, and HUD 202 sites. As soon as that process is over, there will be no additional allocation that we need to make to that program. So we will continue to drive down that vaccine. And if you see that slide in the press briefings in the future, you will see that that number is going to change dramatically, because we're no longer, we now understand what the burn rate is for the utilization of vaccine in those environments. So we know where we can and cannot or should not allocate vaccine moving forward, and that gives us the opportunity to take that vaccine back and get it in arms. So I think as we open to the general population in the way that you've seen, We have already, been through all of the testing of our demand signals so that we know and understand when to open another week of vaccine appointments, to another group as necessary. So we monitor that on a daily basis and we make those changes as appropriate, and we'll continue to do so that we can make this as rapid a process as possible as the vaccine continues to come in.
So I have two other questions before I'll open it up to the rest of the committee. One of them is, as we advocate for more vaccine, are we advocating based on Rhode Island has a much higher elderly population than other states, therefore it should be scaled up onto how many vaccines come to Rhode Island?
We absolutely are, sir.
Yeah, and the other thing is, early on in one presentation over the last few weeks on your Thursday 1 o'clocks, you talked about communities with the highest levels of COVID-19 being prioritized. I think they were Providence, Cranston, Pawtucket, Central Falls. I might have covered all of them. I think Warren might have been on that list too, at least at that point. So is that still something that's going forward, and how does it look different in those communities if that's still a priority?
Sure, we examine that through all of the channels to ensure that we're offering coverage. So for instance, with the retail pharmacies and their opening, we've been working very closely with them, examining where the social vulnerability index indicates that we should be vaccinating for individuals who are experiencing other social determinants of health and are therefore subject to poorer outcomes due to COVID infection, as well as where the infection rates are the highest. So you mentioned Warren as an example. That was a town where we targeted opening a retail pharmacy opportunity as quickly as possible. Started with CVS to ensure that they would be captured. We've looked at the what we call high density community zip codes. And so again, as we were selecting those pharmacies with CVS and Walgreens, we've also been examining that data to ensure that when we have opportunities to open retail opportunities, that they are in the communities that are the hardest hit and have the poorest outcomes, so that people have easier access to the vaccine. We will continue to do that until every potential retail store from CVS and Walgreens, but also our independent pharmacies and the other chains that exist in the state have access to vaccine, so that all Rhode Islanders will have nearby access to vaccine, in addition to our high throughput areas in the RIDOH vaccination centers.
Yeah, I have one other question, I'm sorry, and then I'll go to the committee. That's a call-in, as it's been represented in presentations also, that up to 40%, at least when we start with the eldest population, probably is least likely to engage online and more likely to engage by phone. It's been estimated up to 40% of people in that age bracket, probably going down to 65, still have maybe that level. Is the call-in prepared for that kind of volume?
It is. And so in its initial launch, there will be an automated chauffeur through the process. We have limits that are set on the number of calls that can be received at any one time. So people will, if we are overwhelmed, but at the call center, people will get a message that says slots have been filled for today. Please try again tomorrow. And we will be working on all of those callbacks to people until we can get everybody registered. There are not enough slots to fill for every person who is in the 75 and older population. We've tried to be as transparent as possible about that, but we will continue to build that capacity over time until we have a slot for everybody who wants one.
Questions from the committee? Senator Calkin, go right ahead.
Thank you, Mr. Chair. One question I had was, is there a reason that asthmatics were not included on the list of people with lung conditions that would be able to get the vaccine earlier?
Yeah, it's a great question. If you look at the list, we do include people that have significantly reduced lung function. So people with asthma would fall under that. What we were trying to avoid was people, there's a number of people with like a history of childhood asthma that really don't have significantly reduced lung function. So we didn't include asthma because it's so common in the population. But people that do have a significant degree of asthma should certainly get vaccinated, and they would fall into that category of significantly reduced lung function. And if people have a question about whether or not they would qualify based on their asthma, please do check in with your primary care provider.
Is that how they would go about getting the clearance to meet that criteria? Is through their doctor? Do they need like a doctor's note or something like that to kind of prove that they have that condition?
Yeah, so great question. So we went back and forth about this a lot in terms of, do you need a doctor's note or can you self-attest? So where we've landed is that we are going to allow people to self-attest to their own health conditions. We initially had thought about getting a doctor's note. We did get a lot of pushback, rightly so, I think, from the provider community because it was going to overwhelm their systems, et cetera. So we are going to self-attest. We do realize there's some drawbacks of that approach, but again, at the end of the day, I'm just reminded that we want everyone to get the vaccine eventually, and we're going to have to rely on a little bit of people's honesty to make that happen. And, you know, we're looking at different ways potentially to enforce it, and there's not a great option here, but we are going to, you know, allow people to self-attest.
Great, thank you for that explanation.
Senator Bell?
Thank you so much, Chairman. And first of all, thank you so much to the Department of Health and everyone who works there. You guys have been working incredibly hard, and I want to thank all of your staff for all the incredible work that you've done. I want to start, I've got a couple of issues I wanted to raise. First, I want to echo, and I've communicated this to you guys before, our majority leader's letter about the need for a centralized vaccine website. I'm sure you've heard this, but I just wanted to echo those thoughts publicly. I had a question that was raised by a constituent, and that question was if you guys could clarify the new CDC guideline that fully vaccinated people do not need to quarantine while traveling. And I have a second question, which is that it's been causing some stir in the chart of when people can get vaccinated. It looks like it bottomed out at 16. And so many people obviously are under 16 and would like to get vaccinated. So including people who have health conditions. There was a story about a baby who has cancer who's fighting, or whose parents are fighting to get them vaccinated. So I'm wondering if you could comment on both those things, the CDC guidelines on that fully vaccinated people do not need to quarantine while traveling, and secondly, when people under 16 can get vaccinated.
So I can chime in first, and Alicia, if you have any comments, you can build off. But so to your second question first, so unfortunately, the vaccines are not studied and not approved for anyone under the age of 16. So we couldn't, per the FDA, give those vaccines to people younger than 16. At the moment, both Pfizer and Moderna are currently conducting studies for younger groups, as well as planned studies for children in the future. So I think that's an important note, is that there's no authorization for use of these vaccines yet in adolescents or children younger than 16. So we are all anxiously awaiting that. I think the other important note is that obviously we care a lot about our children. I have a 9 and a 13-year-old myself. And so there are additional safety reviews that come into place. You know, they require a little bit of a longer timeline. There's a little bit more of an intensive review process for vaccines in children, which I agree with, and I'm certainly reassured by. So it's going to take a little bit longer to vaccinate our children, which is why it's really incredibly important for all adults to consider getting the vaccine, especially. So that's one point. I think the other point about the CDC and travel guidance and quarantine after vaccine, you know, the CDC also released guidance that says that you don't necessarily need to quarantine. Yesterday they released guidance about if you've received 2 doses of your vaccine and you're past 14 days. So we at the Department of Health are discussing that actively as we speak. We will certainly be releasing some guidance in the coming days, hopefully in a short time frame about that. Alicia, anything else to add to either one of those issues?
No, thanks, Dr. Chan. Great job.
Thank you so much for your answers.
It doesn't look, Senator Lawson.
Thank you, Chairman Miller. Thank you all for joining us and all your efforts. So I have a couple of questions. One of my questions was, I had a lot of constituents reach out to me concerned about they're having difficulty getting appointments, as you had mentioned, and some of the elderly people were having difficulty creating accounts at the pharmacy. So I'm wondering, do you know when the telephone line will be available for them to access?
It will be next Wednesday.
Next Wednesday. In addition to that, one of the things they found somewhat difficult to navigate on the website was the locations of pharmacies, and they were someone had suggested if there was a possibility to put up like a GIS map that you see, because they didn't know when they went in how far the radius was of the pharmacy. Instead of them being able to put in, I want one 10 miles away, there was just a radius, and they didn't know that span. So that was another one. And I guess, do you have any, what are your suggestions for all of us when our constituents are reaching out to help them, get an appointment? Do you have anything beyond what you've shared?
So these are going to be the primary venues. We're really trying to help streamline the process. Some of it is difficult because there's not a technological way to link into CVS's registration system, for instance, or Walgreens, or any of the other pharmacies that we anticipate will come online. And we understand that that's a frustrating component of this, and we empathize. We have looked and examined to see whether or not there is a way for that to happen. And because there are just too many systems at play, the best that we can do is try to refer people. As the list becomes more robust, we will continue to provide that information in one central website so that you'll be able to come to the website to be able to see what the different opportunities are. And again, we're going to try to funnel a tremendous number of people through the RIDOH run vaccination centers, so that we have that opportunity for people to just go to one location, see all of the different possibilities that are state run, and find the best option for them. For some people, it might be they want to go on a specific day and they're willing to drive a little bit farther than the one that might be closest to them where there might not be an available appointment. We want people to have that flexibility. We don't want them to be locked into having only one option in the state where they live, because we want to accommodate as much as we possibly can in terms of people's flexibility and being able to identify where they live, work, and learn, and recognizing that those might not all be in the same municipality or the same region. So I think that once the website is up and running and we have the rest of the vaccination centers up and running, for the general public, it's going to be fairly straightforward. Again, we love the partnership with all of the pharmacies. Once those are all up and running, we love the idea of having a much more local option. We have a lot of pharmacies in Rhode Island, which makes this a great opportunity for us. But until we have enough vaccine to make that meaningful, it's difficult to continue to open additional pharmacies. So it's a great point, Senator. We'll take that back so that we are poised and ready to identify where those sites are. But the best site is, if someone is interested in a pharmacy option, is to go directly to CVS or Walgreens at this time.
Okay, thank you.
So I don't see any more questions. I'll finish with one question, and I want to thank you in advance. This is really important for us, for Neil and the rest of you to organize the opportunity, because this is beyond our legislation, or before our legislation. This is what we get the most concern from the community about. I have one other question that came up while we were discussing this, and that is in other states, and I know it's come up in conversations, as we get further along in this, is there an opportunity to have a different priority based on people's interaction in the community, such as, I got a call from DCYF workers. Are they considered vulnerable based on how high density some of the communities they go into are, and the incidence of COVID in the communities they go into? Teachers, retail, and food handlers, are those the kind of things that there might be an opportunity once we have more vaccine and we have more capacity, that they will be added to priority along with age?
I would say, Chairman, that anything is possible. That was where we began our planning. The National Academies of Science, Engineering, and Medicine laid out what the high priority occupations were in its initial guidance. So when we began the deep dive last summer to talk about a 4-phased approach, we had, teachers, grocery store workers, other food handlers, all very highly prioritized in phase 2. But as the situation evolved and the data became clearer on the risk that is associated with age, regardless of occupational setting, the priorities shifted to specifically the age-based approach. There has been conversation about the potential for federal allocation that aligns differently to the to occupations specifically. So of course we would take that into consideration. We understand because we all are friends and family members of people who work in every potential high priority occupation, whether that's from a continuity of operations perspective, which is sort of native to the work that I do in emergency preparedness and response. Folks who work in critical infrastructure positions are always front of mind for me. So this has been a difficult shift, especially because we engaged a lot of folks in planning to ensure that we were ready to activate quickly. And then we had to shift our position based on the data. You've heard Dr. Alexander Scott and Governor Raimondo say it numerous times. We are always going to try to follow the data. And the data is far more compelling at this point in time using the age-based approach than the occupation-based approach. I know there's a lot of concern about schools, for instance, but to Dr. Chan's earlier point about not being able to vaccinate children, Vaccinating Teachers has an interesting risk-benefit ratio. Obviously, teachers are of all ages from 20 and up. But so we believe that the age-based approach will be able to address the highest risk teachers. And again, if federal allocations should change or the guidance changes or the data changes, then we will be continuously evaluating each of those opportunities to update what our strategy might be moving forward.
So I want to thank you again, and we'll move on to the rest of our agenda. And I want to congratulate Neil for being much more accurate than I. He said, we've got 45 minutes we can give you. And I said, let's try to do 20. We have a full agenda. So I owe you a safe beer somewhere or something for being way closer to where we might be on this than I had predicted. So thank you very much. And good luck with everything that you're doing. I couldn't be more grateful for all of your efforts.
Thank you, Chairman, and
Yeah.
thank you, committee. Take care.
So I know that many of you had requested that, and I hope it was, we'll get the slide deck and we'll get the, also the web links for anybody to use to further communicate with their constituents so that you can share everything that we, I think people would be surprised at how many people actually go onto Capitol TV and watch these kind of things, and I hope it was helpful for them who were watching also. So